Please share this with as many of your loved ones as possible, because I think this could potentially be beneficial in our fight against COVID-19.
So let's talk about COVID-19 and vitamin D.
Michelle Obama should have been talking about vitamin D, not vegetables.
New study by researchers at the University of Chicago shows the impact vitamin D can have when it comes to COVID-19.
Dr. Schwell, you've advocated for vitamin D as a potential way to prevent COVID-19 infections, to prevent severe COVID-19 infections.
There's so much evidence now for vitamin D. Why is this not being done? It really is quite strange. So 1.77 times more likely to be diagnosed with COVID-19 if they were vitamin D deficient in the past year.
What we discovered was that patients who were vitamin D deficient were about 77% more likely to test positive for COVID than patients who were not vitamin D deficient.
But certainly there's a lot of evidence to show that it reduces the severity of the illness. Clear link between vitamin D deficiency and severity of coronavirus.
When your vitamin D level gets less than 18 nanograms per milliliter, that's the amount of vitamin D measured in your blood, your risk of death goes up 30%.
Guys, for me, it is really this simple. When we give vitamin D upregulates the production of such proteins that work with calcium.
My name is Dr. Christy Reisinger, and the study authors concluded that taking a vitamin D supplement was safe and can help protect against respiratory infections.
So this is not just some vitamin that you need to supplement with. This is actually a hormone that changes the way your cells in the body actually behave.
I'm Dr. Jordan Wagner, and I'm an ER doctor. Another study found that COVID-19 patients who had adequate vitamin D levels had a 51.5% lower risk of dying from the disease.
We know that low levels of vitamin D are linked with higher risk for having severe COVID.
So, I think it does make sense to think about optimizing your level of vitamin D, not so much because of this one study, but because of our general understanding.
25 studies and 11,000 plus people, which tells you that this finding across all these studies is significant.
Pregnant women who had lower intake of vitamin D were much more likely to have children who had asthma and allergies.
Almost 100%. It was like 98-point-something% of patients that died with COVID-19 were vitamin D deficient.
Quite an amazing study, really. It's done in Indonesia, and it shows that people with low vitamin D are 10 times more likely to have complications and die.
Is there a role of vitamin D in COVID-19? Definitely, it has a role before, during, and after.
Later in 1990, that to realise the importance of vitamin D.
So it looks like the action of vitamin D is very important in MS.
Vitamin D does boost and modulate the immune system. People that were the sickest in the hospital and had the longest duration of illness had the lowest levels of vitamin D.
What is the most important vitamin we should be getting to build up our immunity?
Well, based on a considerable amount of science, right now the answer is vitamin D3.
The reason we have more viruses and flus in the winter is because the population's vitamin D level is a little lower. If somebody takes an adequate amount of vitamin D, their risk of colon cancer and breast cancer is reduced about 70%.
There, vitamin D promotes antibacterial, antiviral mechanisms that can help to eradicate the infection.
After giving activated vitamin D, calcifediol, to care home residents and some GP patients, that death rate almost halved.
Vitamin D. It is cheap, it is safe, and it is available now, immediately.
Because one of the most important things you can know about vitamin D is that it augments or enhances your T-cell immunity.
Because vitamin D is very safe and it's very inexpensive.
Vitamin D boosts the body's first line of defense.
But the overwhelming evidence is that it is beneficial both in terms of preventing people getting COVID and reducing the impact of COVID if they do get it.
And now research is suggesting vitamin D could be one key to fighting COVID-19.
So what's the bottom line about vitamin D?
The bottom line, if you're taking vitamin D to prevent osteoporosis, we know that works.
Some research has found that patients with vitamin D deficiency are more likely to test positive for the virus.
To me, the idea that we have to wait for randomized controlled trials to say that yes, vitamin D does do something is a delay tactic.
You can't test your immune system, but you can test your vitamin D level and see exactly where you are.
But if you had low levels of vitamin D and you took supplements, your chances of getting these respiratory infections were reduced by as much as 40%.
Vitamin D is important for so many things. It's not just bone health, but it's also brain health, heart health.
We want to talk about COVID-19 and vitamin D.
Well, vitamin D is really important for a lot of our body's basic functions, especially our immune system.
They performed this systematic review meta-analysis of such supplementation specifically for the prevention of acute respiratory tract infections.
Today we are going to talk about COVID-19 and vitamin D deficiency.
Elle se présente en gélule, en gouttes ou dans des ampoules.
Comment s'appelle le comprimé de vitamine D, le nouveau là?
¿Qué es la vitamina D y cuál es su relación con el sistema inmune y las infecciones virales?
Bẩm sinh hay còn gọi là hệ miễn dịch nội sinh và hệ miễn dịch thu được hay còn gọi là hệ miễn dịch ngoại sinh. Quý vị nghe tôi nói nhiều về hệ miễn dịch cũng biết rằng
I'm Dr. Debbie Osmond, and today I want to talk briefly about vitamin D3, but it's specifically important in dealing with COVID-19.
Researchers looked at the vitamin D levels in the populations of 20 European countries. Countries with low mean levels of vitamin D also had the highest number of COVID-19 cases.
Hi, my name is Ritu Rana. I'm public health nutritionist and assistant professor at Indian Institute of Public Health, Gandhinagar.
You're more likely to come down with COVID. And number two, that if you're vitamin D deficient, especially if you're really deficient, you're much more likely to have a severe course.
If you are low in vitamin D, it affected your pancreatic beta cells.